Hello, I'm Kim Miller and I'm with Inspired Hygiene, and I'm sitting here with Dr. Karen Beck, and we're in McKinleyville, California, and I've asked Dr. Beck to share her experience that she's had over the last, year and a half with Inspired Hygiene, and she has a very unique perspective on this that I asked her to share. So tell us first a little bit about yourself and how long you've been in practice and a little bit about your practice.
So I've been practicing since 2001. I graduated from UOP Dental School back in 2001, and I've been in this practice ever since. And since about 2008, it's been my own practice. And that's when I really decided to make it my own and start becoming current with technologies. And I work with a great team up here, and I have an extended functions assistant who also went to UOP with me, and she works with me on restorative procedures a lot.
Great. So I know that about halfway into your coaching program, you mentioned to me that one of the things that you saw that was most remarkable to you was when you were doing restorative procedures on patients that had already been through periotherapy, you started to notice something. Share that with us.
Yeah, that was a huge change for us. Once we started having our existing patient base go through periodontal treatment and patients getting the treatment that they had been needing but really hadn't been getting, we have a CEREC machine in the office, and it's just crucial for soft tissue management that we have healthy gums. If the gum tissue is bleeding, it's very difficult, even more difficult than with traditional crown and bridge impressions. So we noticed, and my assistant Kendra noticed and commented to me as well, how our patients who had periodontal therapy, we were getting our scans done so quickly, and the gum tissue was so healthy. And when we went to bond our crowns on, we weren't having bleeding when we were cleaning up the cement. And so it's made our restorative end of our practice a lot more predictable. And actually, when we have patients who come in and need crowns, we are typically making sure that their periodontal treatment is done first, as long as they're not symptomatic. And I explained to them that this will ensure us a better result.
So not only is the restorative more predictable, but more efficient.
It's definitely more efficient.
It doesn't slow you down with all that bleeding. So I think that's great. I know that most of the time when we're looking at treating periodontal disease or working with a coaching group that coaches on periodontal disease, the emphasis, of course, is on perio.
Right.
And I don't want to discount that. They've had an incredible, a 250% increase in the amount of perio that they've been providing in this practice. So that portion has gone really well. But I really appreciated Dr. Beck's unique perspective that as a dentist, one of the things that she started to notice early on was how much easier and predictable and more efficient restorative became when the patients had healthy gum tissue.
And we always make sure to tell our patients that too, because it really helps reinforce when they know that their gum tissue is healthy. And I tell them this prep was a snap because your gums are so healthy. It really helps them appreciate the fact that they went through treatment.
That's wonderful. Okay. Well, thanks very much for taking the time to share that, not only with myself, but all of our viewers that are going to get to see your video.
All right.
Thank you very much.
Thanks, Kim.